Hello, my name's Alan Kerry. Welcome to another podcast from South Essex GP Training. With me I have Dr. Sunil Gupta, and we're going to talk about the NICE guidance on attention deficit hyperactivity disorder, which was issued in 2008. So Sunil, what is attention deficit hyperactivity disorder?
It is a heterogeneous behavioural syndrome with core symptoms of inattention, hyperactivity and impulsivity.
What does NICE say about the assessment and diagnosis of ADHD?
NICE says that ADHD symptoms should meet the diagnostic criteria in DSM-4 or ICD-10 and be associated with at least moderate impairment in multiple settings and be pervasive, occurring in 2 or more settings. The diagnosis should include assessment of the person's needs, coexisting disorders, social, family, educational / occupational circumstances and physical health, and for children and young people, NICE advised that we should assess the parent or carer's mental health as well.
What do they advise about the training and the role of specialist teams?
NICE advises that trusts should ensure that specialist ADHD teams develop age-appropriate training programs, that teachers who have received training about ADHD should provide behavioural interventions in class.
And do they say anything about parent training and education?
NICE advises we should offer parents or carers of preschool children referral to a parent training / education programme as first-line treatment. We should offer parents or carers of school-age children with moderate impairment a referral to a group parent training / education programme, and it also advises a group treatment programme for school-age children, i.e. CBT, and or social skills training may also be offered.
What about advice for comprehensive treatment plans for children and young people?
NICE advises drug treatment for children and young people with ADHD should always form part of a comprehensive treatment plan that includes psychological, behavioural and educational advice and intervention. So it's not just giving medication. And NICE also advises develop transition service models according to best practice guidance.
What about comprehensive treatment plans in adults?
NICE advises drug treatment for adults with ADHD should always form part of a comprehensive treatment programme that addresses psychological, behavioural and educational or occupational needs.
Do they say anything else about drug treatments?
For school-age children or young people for severe ADHD, offer drug treatment as first line for ADHD without significant comorbidity. We're talking about methylphenidate. And methylphenidate should also be offered ADHD with comorbid conduct disorder and also for tics, Tourette syndrome, anxiety disorder, stimulant misuse or risk of stimulant diversion. And for school-age children or young people, in terms of where does atomoxetine come in, it should be prescribed if treatment with methylphenidate is ineffective, if there's intolerance to low or moderate dose methylphenidate, and for tics, Tourette syndrome, anxiety disorder, stimulant misuse or risk of stimulant diversion.
What does NICE advise should be discussed about the local services for ADHD?
There's a number of things which should be discussed. Things like what training is available locally for healthcare professionals who come into contact with a young person or adult with ADHD. How do we involve young people or adults with ADHD and their parents / carers in making decisions about their care? To what extent is current provision of parent / carer training programs or group training programs meeting local needs? What is our local care pathway for all ages and how does this integrate with other organisations? And finally, how do young people transfer to adult services in our area?
Thank you. To find out further information, can we suggest that you look at NICE's own website, which is www.nice.org.uk. Thank you for listening to this podcast. We hope you'll try out some of the other podcasts available on this website.